welcome back. My name is Sheldon McLeod. This is Thinking Out Loud, presented to you here on the SaltWire Network. And we've all been very much engrossed with the story of Allison Holthoff and her story, her family story. And recent Freedom of Information request by the Nova Scotia New Democratic Party found that on average, there are more than 500 people per year who don't make it out of a merge. And Susan Leblanc is an MLA with the New Democratic Party. She's also the party's health spokesperson. And Susan Leblanc, thank you very much for joining me.
Thanks for having me, Sheldon.
This idea that we're in a situation where I think it's intuitive that if people are sick and they go to emerge, or if they're in a car accident, or if they have a heart attack, they might not make it. Was there anything in this FOIPOP, in this Freedom of Information request, that surprised you about the numbers?
Well, I think the thing that's concerning about the numbers is that they are trending in the wrong direction. So in the last couple of years, and in last year in particular, we've had the highest percentage of deaths in the emergency room, highest number of deaths. And so that's obviously going in the wrong direction. And whether there's an explanation for that or not, that is what we're questioning right now. That is why we're calling for an inquiry into these numbers, a public inquiry, so that there can be some, intense looking at these numbers, at the situations, and the information be made public afterward.
Yeah, and data analysis, that's a specific skill set. And people who are data journalists would know more about what they were looking at than I. And it breaks it down by region, by quarter, year over year. Obviously, 2020 was a bit of an anomaly given the pandemic and the lockdown. There were about 400 compared to the average of about 500 deaths per year. The most recent inquiry we know about was the mass casualty inquiry. And I'm wondering where you would hope an inquiry would take the data, where it would go, how it would, end up giving us information that would be of benefit, knowing we're in the midst of a crisis.
Yeah, it's a great point. I think that ultimately what we'd want to see are some recommendations, so that an inquiry would look at the cases that have happened, be able to shed some light on, what the circumstances were. Like, were those deaths, unpreventable or preventable? Were there mistakes made? Were there, all kinds of things, whatever goes into an inquiry like that. But ultimately, one would hope that the end result would be recommendations that the government would have a tangible plan to follow, to do what they've been elected to do, which is fix healthcare.
This particular story, the last story that we're talking about, and I've said, 500 deaths is a statistic. One death is a tragedy. And we have this tragic situation. And the Department of Health says, and Nova Scotia Health Authority says, we have a process to investigate, and that they do report back. But those reports are private and confidential because it involves medical information. So doesn't this information exist already? We just need to look at it?
Well, it exists for certain people, but it's not made public because of what you said, because of privacy and that kind of thing. So yes, you referenced the tragic situation with the Holthoff family and Allison Holthoff. Very, very sad situation. And it's really struck a chord with Nova Scotians, people who may have similar experiences or close calls, for instance. But it has awakened, I think, a concern on behalf of Nova Scotians for their loved ones who may have, a similar experience. And so, yes, after every death, apparently there is an investigation, an internal investigation that is triggered. What we're asking for is sort of a more bird's eye view of the entire sort of system and all of the situations that have happened, and for general findings to be made public. We will never know the details of the case that happened last week, unless unless a family member makes them public or whatever, but that wouldn't be made public normally after a regular investigation.
You're a member of the Legislative Assembly. You hear from constituents. You know what is involved with privacy and confidentiality, and in this case, the widower had filed, signed off on it and said, I give you my approval. I'm giving you, the authority to speak on my behalf as my elected representative. Again, speaking of Elizabeth Smith McCrossan, would it not overwhelm all of us to know every story? I mean, wouldn't that really it's demoralizing as it is to know that this can take place, but no one's pointing fingers of blame at this point.
Well, I think that's a really good point. You know, we know that, for instance, you referenced the Mass Casualty Commission. That's been very difficult for many people to follow, and for the people that have worked on that commission. You know, it's a lot, and so we're not necessarily saying we want all the terrible details of every case. We're just looking at lessons that can be learned, maybe trends about reasons why, how many hours has it taken on average to be seen, those kinds of things, so that recommendations can be made to hopefully make those numbers trend the other way, the right way. People are concerned. People are worried about themselves, their loved ones. People are feeling much sympathy and empathy for the Holthoff family. And we need something that will instill public confidence in our public healthcare system. And so if there's a way for people to feel like, when they call 911 or when they go to the emergency department, that they're going to be okay, then that's important. We want to reiterate or iterate that, or emphasize that, it's really important, in spite of these disturbing or trending numbers, that people do call 911 and people do show up at the emergency department if they need help, because there are so many qualified and amazing medical professionals who are there to help and to make sure we're okay. We need to do that.
And there's no question they're overwhelmed. I know someone who works in the healthcare facility who says the biggest challenge right now is people are angry, they're frustrated. And you can imagine not having a family doctor and you have to go to Emerge because you want a prescription renewal. You can't get to your family doctor. You can't get, there are all these things converging at once, and we don't want to blame the people involved. I keep using the phrase, don't hate the player, hate the game, but it's not a game. This is serious. Should it be, does this need to be communicated directly and bluntly that we're really in a bad spot right now because of a lack of staff, a lack of healthcare professionals, and a lack of access to primary healthcare?
Yeah, well, I was going to say, I think that the situation in emergency departments obviously raises red flags all over the healthcare system. And so we know, again, this same week, we've learned that 4,000 more people have been added to the Need a Family Practice waitlist. So I have 130,000 people in Nova Scotia that don't have access to a primary care provider. We also know that people are waiting, days now for virtual care, which was supposed to be the stopgap Band-Aid measure for lack of access to primary care. And we know that when people go to walk-in clinics, you have to arrive 3 hours in advance for the 20 appointments that are available, and many people just get sent away. So yeah, it's a problem. And we also know that people are waiting, more than the appropriate amount of time, in some cases much more time, for ambulances if they call. So, all of these things are signs that our system is crumbling. The people working in the system are at the ends of their proverbial ropes. Like they are begging for change and for help. And we need to see real quick action on behalf of this government towards those issues and do the job that they were elected to do, which is fix healthcare. It's a big job, but they said they were ready for it.
And at the risk of evoking another political decision, New Brunswick had a similar situation. Someone died in an ER and a CEO was fired. A health minister was shuffled out. And in Nova Scotia, we had this allegation that, there was a story trying to be silenced by the Justice Department, alleged political interference. And it's really getting to the point where you go, what needs to happen to make the change? Who needs to say what? What do we need to hear in order for us to be confident that a promise to fix healthcare is not just a promise?
Yeah, I think that's the billion-dollar question. I can't speak to the issue or the situation in New Brunswick, and I'm not suggesting that I know what the answers are for Nova Scotia, but what we're saying is let's take a real hard look at this, and quickly, so that we can figure out what the issues are and what changes need to be made. There's been a lot of talk since the government was elected on listening to healthcare workers and to community, which is all really important, but to date, we have seen very little in the way of the numbers, like which is the evidence of all of that work taking hold and making real change.
Susan Leblanc, we'll leave it at that for today. It's a lot to take in, and it's a lot to absorb, and it's obviously been a tragic time for so many folks. And stay well, stay healthy.
Yeah, you too. Thanks. Take care.
Susan Leblanc is the health spokesperson for Nova Scotia's New Democratic Party.